Hello, this is Dolores, Dr. Barbo from Neighborhood Connections. Welcome. I'm here with Mary Claire again.
Hi.
And we're here to do part 2 of our lower respiratory, more than anything, problems. We started last broadcast speaking about lungs and bronchioles and throat inflammations and cough and bronchitis. If you didn't see it, and some of this won't make sense, why don't you stop whatever you're watching and go back to your computer, pull up GNAT or GNAT-TV, GNAT-TV, who's broadcasting this, and look for our first broadcast on lungs. Mary Claire, we were talking last time about cough. Do you remember what do you remember some of the things I said about cough? What we can do for cough if we have one?
Some of the things that irritate. Why do we have cough?
Yeah, why do we have cough?
Our vocal cords are being irritated by something.
Good, they're being irritated by something. And what are some of those things that can cause that?
If it's coming, sometimes it comes from below, which could be acid reflux.
Right, it could be the acid coming up from your esophagus and back.
Right.
And irritating your vocal cords.
Or a nasal drip, something from above.
Okay. Is there anything else from below that would cause that?
Some kind of irritation.
To what? Like what else? What other kind of liquid could be coming up and bothering that if it's not your acid and back?
Water.
What's here?
Your pleura, your lungs, your heart, your...
One more thing.
Cut this part out.
How are your lungs connected to your throat?
With the esophagus.
No.
With the thorax. With the... Cut that part out.
What do you call these things?
The bronchia.
Yeah.
Yay.
Your bronchia, your tubes going down into your lungs.
Yes.
If you remember from last time, we spoke about the fact that your lung apparatus down here is actually composed of 2 parts. One, if you turn an apple tree or a maple tree upside down in winter without any leaves on it, you're going to get all these branches filling your whole area. We think it's our big plastic bags of lung, but it isn't. It's our branches that are filling every bit of that. And at the end of every tiny branch, what is there?
Like a little balloon.
A little balloon, and those are your lungs. So anything that's not that balloon is your bronchioles. Okay? And those bronchioles can get all inflamed. And if they get inflamed, what do they produce?
Mucus.
Mucus, thick mucus, okay? So your cough can be irritating from any of those things. And what are some of the ways that we can clear out some of that mucus?
Well, humidity.
Good. Humidity, how?
You could take a hot shower. You could put yourself over a humidifier.
Okay, so any kind of humidity that you can get. And you can drink a whole lot of liquid too, because if you're not drinking and become dehydrated, that mucus has no liquid to draw into it. Okay, so drink lots of liquid. Is there anything else you can do?
There are cough suppressants and cough expectorants.
Good.
Yeah.
All right, what does the expectorant do?
The expectorant gets rid of all that. It liquefies the mucus.
Right, and those are, the expectorant are what you see in the basis of all of your cough medicines. The Robitussin, the Mucinex are all basically guaifenesin.
Will it say that on the bottle?
It says guaifenesin.
But does it say expectorant or suppressant?
It might, someplace it should.
Okay.
But if you have this kind of problem, what you really want to get is just plain old. And the problem is you go into the store and you look under cough medicine, and there's 25 versions. It's like going and buying cereal.
Yeah, it's confusing.
You know, there's Robitussin D and Robitussin DM and Robitussin E and Robitussin AC and unless you know what you're buying, so would you please just stick with Robitussin or stick with Mucinex or I'm not promulgating any. Stick with something that's guaifenesin.
Okay.
Okay, that will at least soothe that something. There are some that have bromelain, and bromelain is, we were talking about pineapple. Pineapple has a natural anti-inflammatory that goes to your bronchioles, and bromelain is one of those. So some cough syrups have guaifenesin and bromelain in it, you know. But what does a suppressant do?
It just like paralyzes your cough.
Right, it'll stop your cough, and that's really wonderful. When?
It's wonderful when it's just so irritating that you can't. Maybe you need to go to an important meeting and you don't want to be in there coughing. And,
good. Okay. So if you have a productive cough, you really shouldn't stop a suppressant because we really want to get rid of this thick mucus. But if you have to go to a really important meeting and you can't cough, or if it's keeping you up more than a night or two, at least at night you can take a cough suppressant. But it's not smart to take the cough suppressant all the time. Are there any times when you should absolutely not take a cough suppressant?
Is that when you have a dry hacking cough?
No, that's when you can take it.
That's when you can't.
Because you're not getting rid of anything.
Yeah,
We don't care if you're taking guaifenesin if you don't have anything to get rid of. No.
No, I don't know.
Most of the medications that suppress a cough suppress it with a side action of raising your blood pressure.
Oh, yeah.
Right?
Okay.
Most decongestants, most cough suppressants are things that will be dangerous if you have asthma when you have to get rid of some of that mucus, and will make it worse. Or if you have glaucoma, which is high eye pressure, or high blood pressure, or a cardiac problem, you absolutely should not be taking cough suppressants.
Okay.
All right? So keep that in mind.
That's good.
There are cough suppressants of the morphine family that will suppress a cough. In Canada, you can get codeine over the counter in a very low dose in a cough medicine, and that's a cough suppressant. And it doesn't do quite the same to your blood pressure as some of the things you get here over the counter that will actually raise your blood pressure.
What if you have an alcohol issue? Is there alcohol in these cough?
In some of the cough medicines there are, and so yes, thank you. You should really be reading the bottle and seeing how much alcohol, just like in mouthwash, that there is, so that if you really are working at and have been clean and sober for a certain amount of time, you want to be really careful about taking some of these cough medicines. Thank you. That's a very good question. Okay. All right. Let's talk about one more bronchial problem. And this is not lung, this is bronchial. If you remember, lungs are those little balloons. And that's asthma. What do you connect anything in your head with asthma? I know I'm asking you without you having even thought about this yet, but what comes to your head with asthma?
I just think of inflammation. I don't know.
Do you know anybody with asthma?
I do not.
Oh.
No, I don't know anyone with asthma.
Did you know any kids in school with asthma?
Yes.
And what were they like?
They were wheezy.
They were wheezy. Asthma it also produces very often mucus, but it's not caused so much by inflammation of the bronchioles, of those hollow tubes, okay, as almost a squeezing shut, okay, a contraction almost of so that you tend to be able to get air in, but you just can't get it out, no? But you can hear it going in and out and going.
It sounds really dire.
It actually can. You can get kids that, what we see often in the ER especially, kids coming in that are totally blue. I mean, they just have no oxygen. They're short of breath, they're coughing, their chest is tight, they're wheezing, they're not feeling good, okay? Do you know what would cause asthma?
I don't know what causes asthma.
Because you said the word inflammation. What causes inflammation? What the heck is inflammation?
Well, maybe it's the little cilias aren't cleaning something out, no?
No, but like if your tooth is inflamed, or what does that mean? What is
Something's
inflammation?
Irritating. Yeah.
It's irritated. So something's irritating. It doesn't always mean infection. It doesn't always mean pus. It doesn't always mean. It means that something's irritating it to the point that there's changes in the tissue. Okay. Usually with an inflammation, like if you banged your knee, we would expect it would be maybe red. It certainly would be swollen. Liquid collects there. Okay. So if you're having an inflammation of your bronchioles in asthma, it would swell and close in because it's swelling, and you might have collection of liquid there. So you might have you might be coughing and trying to get stuff out. It might not be a dry hack and cough.
Are you born with asthma?
No, but it can be caused by asthma. It can be caused by allergies.
Oh, okay.
Okay, like some of the kids, I don't know what would have triggered it in school, but very often in the springtime and in the fall, people are reacting to different allergens in the air. Like in the spring, pollen can bring this on.
Right.
No, and it causes your bronchioles to close, and people just can't breathe.
Chalk dust in school.
Chalk
dust in school would be attributed to some children's asthma. Yeah.
Wow. Now there's one for you. But actually, occupational exposure. I mean, people get asthmatic attacks if they have a reaction to things in the barn, and the barn doors are closed and they're working, and so you can have a reaction to chalk dust. I imagine the same way you could have.
So does it just come on?
It can come on suddenly. Environmental.
Oh, okay.
People react. Even things. This is crazy, but cockroach debris.
Yeah.
There are people that really react to that. No? So you wouldn't think of that.
No,
and there are
no,
cockroaches in barns. It's not just the hay. You can also have an allergic reaction to food. Like I think last show, shrimp is one of them that can do that.
Strawberries.
And strawberries can do another. Scallops can do it.
Right.
So different things can cause that kind of contraction. How do you treat an asthma? What do you remember about the kids in school?
They had, well, I don't know back then, but then later on they had an inhaler. So they'd spray something in their mouths, and I assume it was opening things up.
Right. There are two kinds of medications that you use. One is for an immediate response, okay? Because it can be caused by an irritant or an allergen. It also, in parentheses, can be caused by, have you seen people that suddenly get scared or have panic attacks?
Oh,
stress, either stress that is tangible and real because something stressful is happening, or people that have panic attacks without even, can't figure out why, get short of breath because of that same contraction.
Is it adrenaline?
That can cause that, yes. Okay, so the irritant there is something from within.
Okay.
Okay, so stress can do that, exercise can do that. There's most of the kids that I see that have asthma, they have to do something before gym. Okay. So the treatment is two things. There's usually inhalers. And if the inhalers don't work, there's other kinds of medication, but we start with the inhalers. There's an inhaler that you'll see the kids use 10 minutes before exercise. Or adults if they're going to be doing playing tennis or doing whatever, and they have asthma. They can go ahead and play, even though exercise, breathing fast and trying to get oxygen, you can cause that reaction. If they use this inhaler roughly 10 minutes before it's going to start, they will keep their bronchus from closing up. But if asthma is a chronic thing, you're chronically exposed to this pollutant of some sort, this thing that's causing it, there's another inhaler that you use once or twice a day that has anti-inflammatories in it. So it doesn't let your tissue get swollen.
Oh, okay.
All right? We may talk later about how to use an inhaler, but for now, just know that asthma is not caused by something that needs an antibiotic. It's something that is treatable, but it generally is treatable by medication. This isn't one you can use natural medicines for because it's being caused by an irritant of some sort.
Can you grow out of it?
People tend to grow out of it, just like you get so used to, you get exposed to the allergen so often that your body just doesn't respond to it anymore.
Okay, like bee stings.
Okay. Just like bee stings can do that. The one time that a bit of natural help outside of using these inhalers, would be if your irritation is stress. If the thing that's causing that is stress, then working very hard at reducing stress might be a real help for asthma, okay? So let's move on down to our lungs. There's a couple things that are particularly known out in the community about lungs. One is one that doesn't last very long, and that's pneumonia. What do you think is pneumonia?
It's an infection.
It's an infection. Okay, agreed. It usually is an infection. It's usually germs of some sort. It's something from the outside that got in. It's either bacteria or viral or mold, spores, fungus,
And
whatever.
you can actually see that on an X-ray.
What you can yes, you can see those balloons when the balloon. What we're looking at is a collection of liquid in the balloons. You know how your bronchioles produce mucus? What happens in the lungs, if I get bacteria in my lung, in that balloon, my body registers this because I have all these blood vessels going around that balloon trying to collect the oxygen, and it registers that there's liquid there, and it sends in white blood cells by the army full to kill off that infection, and I end up producing liquid in my lungs. This is important. If you remember, we had that, I don't have it with me, but we had the bronchioles coming down here in these two big plastic bags of liquid. That would be horrible because you'd have a whole lake down here.
Right.
But that isn't what happens. What happens when you have pneumonia is that, if you remember correctly, we had, let's say on the left side of our body, we had the trachea coming down, and it split into two main branches. Okay, and this split into three, etc. On these two branches that then had a million branches here, which I'm not going to draw, and had balloons at the end of them. If I have pneumonia, I most often have pneumonia, these are a million balloons off a million branches. I only have pneumonia in one part of my lungs. So I only might have pneumonia here. This might be all clear, and I can breathe fine, except that this pneumonia is causing me irritation and liquid and dripping and fever and not feeling good. And so we talk about a lobar pneumonia, meaning it's in your right base. It's only here, or it's in your right middle lobe. All right. Pneumonia is a more localized usually. Okay. People talk about double pneumonia. And yes, double pneumonia. All they mean is he has it on both sides of his lungs, someplace in some of the lobe. You can have mostly a walking pneumonia. You think of walking pneumonia? But people have walking pneumonias when they're not in bed in the hospital dying.
Really sick.
Yeah, you can have pneumonia. Pneumonia is nothing more than a germ that got into your lung, as opposed to your bronchioles, as opposed to your throat, as opposed to. It doesn't mean anything more serious. As long as you've got the other four sections of your lungs, your three on the right and the bottom one on the left, for instance.
But why do people die from pneumonia?
Well, because when your immune system's down, and the germ starts going to other parts of the of your body, including the other lobes. If you don't have enough white blood cells and defenses to fight that, then. And usually people die of pneumonia when their immune system's really down, when they're really old. I would like to say really old being 85.
Or 90.
Yeah, or 90.
Okay,
That's really good.
Yeah.
Only because I'm really old and I don't want to talk like that.
No.
But you have to really be a bit fragile. Okay? Very often sick with something else. And then unable to fight the pneumonia.
Okay.
In the nursing homes, they say pneumonia is actually an older person's best friend.
Right.
Because
Sounds horrible.
It is horrible, but actually it's a very good way to die. Yeah, people are sick with a lot of other stuff that hurt, and you get pneumonia, and you slowly get weaker and weaker because you're getting less and less oxygen, and you go to sleep and you die.
Okay.
Which is very often an easier way to die than to die of a heart attack or a stroke, and you can't move and you're paralyzed.
Yes,
and
right.
Okay. Pneumonia is caused by, most of the time, a germ. Meaning something from the outside. It can also be caused by aspiration.
I hear people with Parkinson's sometimes will get pneumonia.
By aspiration, what does that mean? What are they aspiring?
I think they're swallowing water or something.
Right. They're choking on something because their muscles aren't coordinated with Parkinson's.
Right.
No? And so the vocal cords aren't working in conjunction with anything, or they suddenly start coughing and can't control it, or so they're eating and or drinking and things. You can also get aspiration pneumonia, unhappily, by having a really bad acid reflux and lying down and having it come up, and you're breathing it in, and it goes right down your tubes, right down to those balloons. Okay? So aspiration is different than a germ.
Right.
That's liquid you can't figure, it's harder to get out sometimes. Okay?
Goes down the wrong way.
Goes down the wrong way and goes all the way down into the balloons. Okay, most of the time when liquid goes down the long way, it only goes down as far as here, and we're able to cough it out.
Yeah, right. Okay.
It's when it trickles down into the balloons. The balloons don't have muscles that make them do this. Okay. We were talking about you can die from it. Usually from pneumonia, what kind of symptoms do you think people do feel?
Well, I've never had pneumonia, but probably feverish.
Yeah, very often there's a fever, especially if it's bacterial.
Right.
Okay.
They probably have trouble breathing.
So you're short of breath because you're minus part of your oxygen. You're hot or feverish. You tend to get really fatigued if you think of older people. They get very tired very easily because they're lacking some oxygen and because they're fighting an infection. They just get worn out and sometimes confused. When we see older people who are beginning to have mental status changes and they're not feeling well, we check for one of two things. A urinary infection is an automatic response, or to see what their lungs are doing and their heart's doing, because we know that there's something going on, that their brain isn't getting enough oxygen and they are getting some toxic stuff. Okay, so you can have nausea, and you can even get nausea and vomiting and diarrhea as a side effect of this, because it's coughing up with bacteria and stuff that we're swallowing, and so things get generalized very easily, and especially the older you get.
You hear talk about bacterial or viral pneumonia.
Yeah, this is that's a very big thing. We tend not to be able to tell very easily. A good rule of thumb about virus and bacteria, unless we're talking about really older people who tend not to get a fever anyway. All right?
Really?
Yeah. Older people can be very sick and aren't having a fever. So if we're seeing...
Excuse me.
Salud. If we're seeing somebody that's 80 who's running a fever of 103, we really get worried, because that's uncommon.
Oh, I didn't know that. Okay.
But viral diseases tend to cause more of a fever than bacteria. Young moms don't know this nowadays, but if you remember, if it was existing when you were there, if people got measles or mumps or whatever,
Sure.
they got a fever.
Yeah, chicken pox.
Yeah,
those,
you could get a fever of 103, 104 easily. Bacteria tends to have a lower fever than that. Okay, but you tend not to know. The difference might be that a virus lasts, not the cough, but the general feeling of not being so good, lasts 2 to 3 days in a viral pneumonia, and it can last a lot longer than that in bacteria, because for bacteria you often need
5 minutes.
Wow.
antibiotics to kill off the...
Which one do you take antibiotics?
For the bacterial.
Oh, bacterial. Okay.
For a virus, and most of these again are viral, you don't do that. The
But you
problem
can't
is
tell.
we can't tell. Something that's lasting more than 3 days, a fever that's lasting more than 3 days, a cough lasting more than a week, a general malaise that you're just not feeling good, you probably should look for some help. And what we'll do usually if there's something we can't really tell, but it sounds like it's bacteria, we may give you an antibiotic. If when you come in the office, I'm listening to you, the sound I hear is no longer that blowing over the Coke bottle that we got with bronchitis.
Okay.
What I'm hearing is take your hair and rub it in front of your ear. It's not long enough. There's a crackle.
Okay. Yeah.
If things were really quiet, if you or get somebody else's long hair and do it in front of your ear, that crackle we call crackles or rails is pneumonia.
Okay.
It's very particular to pneumonia. If we hear that, and you're looking bad and things aren't good, and we may give you an antibiotic. But before the antibiotic, the ideal might be, and we try to get older people to do this, is to give us some sputum, so that we can send it to the lab. They'll culture it and find out what bacteria it is, and what antibiotic would be good specifically for that bacteria.
Is it unsafe not to start on an antibiotic right away?
Well, as soon as you give us some, if you come in really sick, we're going to start you an antibiotic.
Okay, yeah.
But if you're looking like it and you can give us some sputum even then, if you can really cough up some sputum, not spit, but some sputum from below, we'd rather do that before we start the antibiotic because it's going to change the dose, okay? So, and that's pneumonia. It's not a very complicated illness, but it's liquid collecting in the lungs. Remembering that liquid could be aspiration pneumonia, which could be acid or something you've choked on, or water from Parkinson choking, and it could be if you had that fracture we talked about before, and you had some bleeding going on in your lungs. It could be blood collecting from trauma. But usually we're talking about infectious pneumonia when we talk about pneumonia. Okay. I still never got to COPD and emphysema and any other questions you had. Oh, and TB. So how about we'll have part 3 of lungs coming up very soon. Meantime, read up on whatever you want. Look at the first program if you didn't see it, and we'll see you next week.